Good afternoon. So in my previous video I demonstrated how to give an injection, but this time I'm going to demonstrate how to do intravenous care, which is IV. Okay, so let me just run you through the definition of intravenous care. So intravenous care, this is just the process of assessing the intravenous infusion line, okay, putting into consideration the fluid that is being infused, the rate of flow, the signs of infection, and the extravasation. Okay, so that's basically the definition of intravenous care. Okay, so now let me just talk about the indication. So the indication are patients that are on IV infusions, okay, intravenous infusion. Okay, so let me just run you through as well the principles. So the principles are: this procedure, which is IV care, is a sterile procedure, therefore we need to maintain aseptic techniques. Okay, then the other principle is we need to make sure that we do not introduce air into the patient's body. Okay, then the number 3 principle is that we need to record the patient's intake and the output. So those are some of the 3 principles of intravenous care. Okay, so now let me just introduce my requirements. Okay, so I have clean gloves. Okay, so these clean gloves, they are expiring on the 24th of November 2027, potent for use. Okay, I have an adhesive tape. Okay, I have a receiver for dirty swabs. I have gloves, surgical gloves. Okay, so these gloves they're expiring in 2028, potent for use. Okay, I have spirit. So this spirit is expiring on the 24th of May 2028, potent for use. I also have normal saline. So this normal saline is expiring on the 23rd of March 2026, potent for use. Okay, I have these Cheeto forceps. So these Cheeto forceps were autoclaved on the 4th of November 2024. I also have a sterile pack for IV care, which was autoclaved on the 4th of November 2024, potent for use. Okay, I also have a drum containing swabs. Okay, then I also have a marking torch. Okay, so these are just the requirements that we need to use when performing IV care. Okay, so now let's make this trolley surgically clean. Okay, so we'll put our drum here, also put our Cheeto forceps here. So now I'm going to wash my hands. Remember, I've already gotten permission from the in-charge, I've already gotten permission from the patient, I've assessed, I've done everything that is in the before procedure. Okay, so I've done all of those things. So now I'm making this trolley surgically clean. Okay, I've already assessed. So the first assessment, you need to make sure that the strapping, you don't remove all the strapping, you just have to loosen it. Okay, so I've loosened the strapping. So now I'm going to wash my hands so that I make this trolley surgically clean. Okay, so I'll wash my hands. Okay, so now we are opening these Cheeto forceps. Okay, we want to make this trolley surgically clean. It was just cleaned. Okay, the normal cleaning. So we have these swabs. Okay. So you need to make sure that your swabs, they are very big. Okay. Okay. So at this point, we'll get spirit, pulling away from the label as usual. So we start from there, 10, that side. So this goes on the dirty receiver. Okay, so this one goes like that. You turn again. This one goes like that. Goes on the dirty receiver. Okay, so we'll get our pack. Remember, this is a sterile procedure and packing starts from the bottom shelf. Okay, so we'll open our pack. This is a sterile procedure. I'm not supposed to talk, but for learning purposes, allow me to speak. Okay, so we'll open like that. Okay, remember you're not supposed to cross hands, so I'll come this side, come this side. Okay, I'll come this side. Okay. Open like that, this side again. So the other way, if you don't want to start turning, you can be turning the trolley. If you don't want to start turning, so you can just turn the trolley like that, then you open your pack. Okay, so this is another skill that I'm teaching you today. Okay, stay with me. So from here now, you get your cheater forceps. Okay, so you open this. This is the inner pack, which is sterile, the most sterile dressing. Okay, so open like that. Okay, like that. So like I said, if you don't want to turn, you can turn the trolley. Okay, so you come this side, open. So in case your examiner asks you question, you need to make a step behind, 1 step behind, 1 meter, then you can talk to the examiner. Okay. So we have a fenestrated towel. I also have a sterile hand towel. Okay. Then we have sterile gauze here and sterile swabs. Okay. So as usual. So from here now, so when doing IV care, we don't use spirit, we use normal saline. Okay, so go away from the label as usual. Okay, like that. Okay, so now I've prepared everything that I needed. So now I'll come to the patient's bedside. Okay, so now I'll get my gloves, my clean gloves. Okay, I'll either sanitize or wash hands. Then I'll wear my clean gloves. Okay, so these are my clean gloves. IV care is a very simple procedure and a very examinable procedure, so you need to know. It's very simple. Actually, one of my favorite procedures in nursing. So you just have to know the steps. Okay? So you wear your clean gloves like that. You can sanitize or you can wash your hands. So we'll get our Macintosh. Okay, so this is our Macintosh. So we'll tell the patient to lift their hand. Okay? So Mr. John, please lift your hand. Okay? Okay, thank you so much. So how was your night today? Okay, so as you are doing these procedures, you need to make sure that you interact with the patient. Don't be procedure oriented. Show the patient that you know what you are doing. Okay, sometimes this patient, they can be very, very devastated. So you need to show them that you know what you are doing. Okay, so at this point, you can even remove this strapping here. Okay, so this goes there. Okay, so now these gloves, the instructions are tear to open. Okay, so so if you find that they're too hard to open, you can get the cheater forceps. Remember, the cheater forceps are supposed to come, both of them, at the same time. Okay, then if you want to use one, you can take back one. Okay. So this goes there, supposed to go on the dirty receiver there. Okay. Okay. You can sanitize as many as you want. You can sanitize and wear your clean gloves. Okay, you can sanitize and wear your clean gloves. Otherwise, to avoid wasting time, I would have even opened those gloves. Even the time that I was putting the solution there, that was the best time for me to open those gloves there, so that I don't waste a lot of gloves. Okay, so at this point now, we've done, I've hand sanitized my hands. So we'll come to the patient. So Mr. John, let me just remove this this strapping. Please come closer, come closer. Let me just remove this this strapping. Okay, so this is the strapping that we had made loose. Okay, so now we are removing it. Okay, so now we've removed the strapping. Okay, so from here now, okay, just focus on the hand, just focus on the hand. So from here now, I'm going to do my sterile hand washing. Okay, so I'm doing my sterile hand washing. I've done my sterile hand washing. Okay, just focus on the patient. Okay, so I've done my sterile hand washing. I'm like this now. Okay, so I'll get this. Okay, so I'll get this. Okay, so that's the first corner. This is the second corner. Okay, up to the elbow. This is the third corner. Okay, so this is the fourth corner. Okay, so this goes there. It can go down. So now let me just wear my surgical gloves. Okay, so today I'm not teaching how to wear gloves. Okay, so this can, okay, so this one goes there. Okay, so these gloves, they are small for my hands. I was supposed to use 7.5, so these are 6.5. So that's why I'm finding it hard to wear them. Okay, that's how we wear gloves, sterile gloves. Okay, so we're now sterile. Okay, this goes there. Okay, so now let's prepare the swabs. Okay, we are preparing the swabs. So remember what I said, IV care is a sterile procedure. I'm not supposed to talk, but for learning purposes, allow me to talk. Okay, so I'll prepare 7 or 8 swabs. Okay, so remember that when we're doing IV care, we do not use spirit. Okay, but in the procedure manual 2021, there is spirit there, so we don't use spirit. 1, 2, 3.